All right, really excited here today. I get to interview Julie Palmer with Palmer Complete Health. So, Julie, I'm kind of interested. What got you started in your career here?
Sure. So I was actually in a bad car accident in 2007. So messed up my neck, my back, my hip. And so I did PT. I did a little bit of pain pills, muscle relaxers, actually did steroid injections, actually flew to Chicago, did prolotherapy, did literally everything under the sun other than surgery. And I was still in pain. And so I just thought I was going to have to live in pain the rest of my life. And that had pretty much become my normal. So when you're in pain a lot, you can't sleep. So you're exhausted all the time. You get depressed. And like I said, I just thought that was my normal. So I worked in ophthalmology and eyeballs actually for 16 years. And I was at work one day treating a patient and he had diabetes. And so he told me, "You're wasting your life." And I said, "Excuse me?" And he said, "You're wasting your life." And I said, "How's that?" He said, "You are very good at what you do and you're very good at explaining things." He said, "I've seen a lot of doctors and nobody took the time to explain to me how diabetes affects my whole body, but also affects my eyes." So he said, "I'm coming back in a week and tell me what you're going back to school for then." And so I said, "I'm too old." And he said, "I'm 75 and I just graduated from whatever it's called, pastor school or whatever, however you become a minister, seminary school, I guess it's called."
Mhm.
And so I said, "Okay." So it's kind of one of those things where you've heard things several times, but it just wasn't the right time. So I actually went home that weekend and took one of the tests online. What do you want to be when you grow up type thing. It actually had me being a bartender, which I was like, I'm not going to be a bartender, and a anesthesiologist or an acupuncture.
Oh,
And so I was like, "Oh, anesthesiology." I was like, so I actually looked into that and I was like, "Oh, I saw everything you had to do to patients and God bless anesthesiologists." I was like, "I can't do that." I was like, "What the heck's an acupuncturist?" I didn't even know. And so I actually realized that I could transfer a lot of my previous education to acupuncture. Honestly, didn't know what I was getting myself in when I signed up for acupuncture, but it's pretty neat because acupuncture addresses the whole body. So it helps you restore homeostasis. So a lot of people had told me after my car accident, that I had some emotional stuff that I had to deal with from the emotions of everything being taken away from me. And of course, your response back is, "I don't have any emotional issues." So it actually helps you deal with all kind of stuff and be able to process it. So yeah, so it was pretty cool. So laser acupuncture is actually what got me out of pain. Everybody assumes because I'm an acupuncturist,
mhm.
I got rid of my pain when I was in acupuncture school. But one of my teachers, actually, of course, everybody wants to fix you. So when he knew I was in pain, "Oh, you can come fix me. I'll have you running in 3 weeks." So, and he actually made me worse because he went directly to my hips, where the area of dysfunction was. So it gave me a greater appreciation for pain and how everyone is different. And just because something works for one person, it's not a one size fits all thing. You have to be able to adapt your treatments and
Mhm.
look at the patient and see, okay, are they having stressful times at home? Because if they are, just taking away the pain in the hip won't fix everything. So, yeah, so it really made me change my life when I was in the car accident because I had never been exposed to holistic medicine before. I was raised going to the Western doctor and you pretty much do whatever they tell you to do. But I really didn't want surgery. So, I looked into everything else. So, yeah, so I have Western, Eastern, all kind of background, which makes it really cool because I can merge everything together.
Definitely. I think that's really great, your experience and everything you're able to share there. And then that transition too from your strong Western background to this more Eastern experience. And then some of the things you touched on as far as evaluation of pain and emotions and how we can see those sorts of things in patients. So since you talked a little bit about your education previously, obviously you had all that strong Western background.
Mhm.
How have you been able to translate that into your practice, and what sort of things have you noticed postgraduate, or even if you want to touch on some of your experiences through school, because I don't think people really understand what an acupuncturist goes through in their schooling.
Sure. So, because of my previous schooling, like you said, Western, I went to University of Florida, so I'm a Gator girl,
Woohoo!
born and raised in Gainesville. So yeah, football's in my blood. But I was exposed to a lot of anatomy and physiology classes, medical terminology classes, and stuff like that. And one thing that was always nice in ophthalmology, patients always told me I brought things to their level so they could understand it. Because a lot of times physicians use really long words and people have no clue what they're talking about. And the physicians don't realize, because to them that's their normal lingo. But I've always tried to meet patients where they are. So if you have, that history, then I'll use longer words for you. Or if you don't, I try to explain to you the dysfunction or the body not working properly in your layman's terms, I call it. So that was the Western background part. So then in acupuncture school, it's kind of like any other school. I always tell people, kind of like going kindergarten through 12th grade is what I consider acupuncture school. They give you that diploma, but you're not really, to me, ready to practice. You have to go out and figure out more kind of specialties or what you want to do in life type thing. So they expose you to a lot of stuff. So I had never heard of yin yang and some of the qi and all the different technology they use. So to me, same thing, I convert the terminology to what I understand. So people always ask me, well, what exactly does acupuncture do? Acupuncture increases blood flow in your body, thus increasing circulation. So anytime you get stressed out, your first reaction is to and get tight. So anytime muscles are tight, things can't flow. So basically, we're putting needles in that help open things up and restore proper flow, which then encourages oxygenation, which helps circulation, which restores the body to homeostasis or normal. So it's pretty cool how acupuncture works. So anytime you have something that's not working properly, a dysfunction, if it's been there for a while, meaning chronically, so chronically is anything longer than 6 weeks, then it takes a little bit of time to restore the brain to working normal, because the brain gets used to that dysfunction and that's its new normal. So it's like, hey, I tried to fix this for a while, but it's not working. So let me just stop and use my energy for something else. So the acupuncture helps retrain the brain. So sometimes I tell people you'll feel like you're almost walking crooked or abnormally as we're retraining your gait or your walk, because we're returning it to where it should be. So it's really amazing how acupuncture works in that way. So for me, I actually fought treating pain for a long time because I was like, everybody knows acupuncture treats pain. That's normal. I don't want to do that. That's easy. And then I finally realized, it's really not. A lot of acupuncturists aren't great at treating pain. I am really good at treating pain because I've been there. So if somebody comes in with sciatic pain, been there, done that, had the pain running all the way down to my foot, like somebody's taking a knife and cutting you open, had the EMGs too. Those are god awful, where they stick Western needles into you and measure electrical flow. So I understand what pain you're going through, and I understand how it's affecting you and affecting your whole lifestyle. And most of the time we can get rid of it. If we're not impacting it, then I'll help you get to a neurologist or neurosurgeon to get MRIs and get further testing done to get worked up. But yeah, so I guess for me, like I said, I specialize in pain. So anything orthopedic related, I can take care of.
I really like the explanation, stepping back, kind of how you started, and you said that you like to break things down for patients and really put things on their terms. And then you literally just did it. You just gave a really good explanation of just how acupuncture works and what patients will expect. So what would a patient expect to happen with a visit?
Sure.
How does that work?
So when patients come in at the front, basically my secretary greets them at the front. Hopefully they've already done their new patient paperwork before they come into the office. She'll get a copy of their driver's license, get everything going, and then I take them in the back. So we go through all of your previous medical history, because if you've had surgery on something, or if you're allergic to something, or on blood thinners, that impacts acupuncture. So it's not like you just come in and I stick 20,000 needles in you, because that's the first thing I hear from people. Oh my God, I saw acupuncture on The Amazing Race and they had a gazillion needles or a gazillion cups, and I don't want that done. So there's a lot of misinformation, and I always tell people they have to make it look really good for TV or you wouldn't want to watch it. So usually for most patients, you're getting under 10 needles put in for me to be able to treat your whole body. So if you're coming in for pain, say on your hip, so I would say hip pain is what I treat a lot, because people have sciatic pain or they're bone on bone and don't want to do a joint replacement. So we go over all your medical history, and then we walk out in my hallway and I actually watch you walk. So I watch your gait, and I will watch to see how your body has compensated, because usually by the time you get into my office, your problem's been going on for a little bit. So your body learns to adjust and learns to put more weight on the left leg if the right leg's hurting, because your brain's like, hey, that hurts, don't do it. So you adjust your hip, but then it also goes up and affects your shoulder, or it can go down and affect your knee and your ankle. So there's something called pain referral patterns or pain adaptation, how your body adapts. So that's what we look at, because if I just treat your hip where you're having the pain, you're going to come back in a few weeks and be like, great, my hip pain's gone, but now I have shoulder pain, or now I have knee pain. So we actually address all the areas of dysfunction while you're there. And I explain to you what muscles aren't working properly and what we can do to make them stronger. So for a lot of patients, we can just, I call it returning on the light switch, or returning back on the power to the muscle to make it work properly. But if that doesn't do it in and of itself, then we actually look at, if you're working with a physical therapist already, that's great. Then I let you do that. If you're not, I give you a couple of simple exercises you can do to actually strengthen the muscles. Or if you have a workout routine, I'll get you to show me what your workout routine is. Because a lot of times, if you're doing the same workout routine prior to developing hip pain, you adjust it. So you're actually going to create the same issue again, repetitive strain on the same muscle, and you'll be back in my office telling me you didn't get rid of my pain. So it's my job to educate you how to retrain your body to function properly. And then basically we get into acupuncture. We use sterile single-use needles. We do not reuse needles, contrary to some people's belief. And we make sure the skin is clean before doing acupuncture. Some people, I always tell people, I tell you the truth. So I'm not going to tell you, oh, it doesn't hurt at all. You may feel something, but it's not bad. So if you've ever had a shot, that's much worse than anything I'm going to do to you. You will be fine. I always tease people. I haven't lost anybody yet. I don't have people screaming, scaring people in the waiting room or anything like that. And I'm actually certified in pediatric acupuncture as well. So I actually treat a lot of kids that play sports. So I adapt, and I use smaller gauge needles for them. So we talk and communicate through the process. And that's what I will say. One of the very first physicians I worked for in ophthalmology, helped me educate me on, as far as if a patient's talking to you, then they're not passing out, you're not losing them. So if you're not talking to me, I know there's an issue, even if you're not telling me there isn't one. So I always tell patients, we talk about the weather, we talk about your dogs, we talk about, where you ate last Sunday. We talk about all kind of stuff, because I can distract you, and then I can do more in the treatment. So then we finish the treatment. You're usually, new patients are in and out of my office within an hour. Follow-ups are usually about 30 minutes. I always tell people to eat before they come, so that we don't have to worry about moving too much stuff around in your body and then making your blood sugar drop. So then we take you back up to the front desk, and then we develop a treatment plan for you, so you know how frequently you're coming to see me, what our goal is, what we're trying to establish. That's different for each patient. So some patients, they just want me to get rid of the acute pain. For some patients, they want me to get rid of their chronic pain, and then they're like, oh, you can work with me on my nutrition as well? Great, let's do that. Let's review blood work. There's all kind of different facets. So I meet you where you are, and whatever your goals are, help you achieve them. And if I can't help you achieve them, I help you to get somebody who can. So, yeah.
Awesome. That's really great. Thank you. So I know you talked about education a little bit. I've heard a lot about a technique called dry needling. Are you
Mhm.
familiar with that?
I am familiar with that. So, about what, probably 5 or 6 years ago, I guess it became really popular in the athletic world, kind of like how Michael Phelps made cupping popular. There was somebody that actually made dry needling more popular because it's been around for a really long time. Janet Travell, a Western MD, is who actually did a lot of research and has some really, really good books for pain referrals, meaning even if you feel pain in your hip, it can send it down to your foot or down your leg. So she actually mapped out the pain referrals, and I'm so glad she did it because it makes our lives so much easier. But she actually used hollow needles, meaning Western gauge needles, to do dry needling. So I'm so glad I don't have that done because that hurts significantly. But yeah, so dry needling is basically, I look at it as another form of acupuncture. So you're using a different technique to do the needling, meaning you're trying to get a muscle twitch or a fiber release and response because that turns back on the muscle so that it's actually getting the electrical function that it needs. But for me, when I took my dry needling certification at a very prominent group called Myopain Seminars, and I think they do amazing work. And I think they are the number one dry needling seminar in the country by far to me, because they have the science background behind it as well as teaching you the actual practical skills. Um, and I just lost my train of thought. Uh,
You're doing great.
so, oh, dry needling. So anyway, they teach you to find like a top band of tissue. For me, since I know the trigger point referral patterns, I usually also incorporate it into a trigger point. So I'm getting kind of, I call it two for the price of one. So I'm hitting both things at once. And then usually what I'll do is I'll needle gently into it and get one or two light twitches. And then I'll actually put what's called a pointer XL, something that puts current into the needle and makes the muscle twitch. And it's a lot less painful than just doing straight dry needling. So if I have an athlete that comes in, I treat a lot of football players, lacrosse players, soccer players. They think no pain, no gain. So if they want pain, I can bring it, no problem. I can really make them twitch, significantly, and they love that, and I'm okay with that. But for me, I don't personally like pain if I can achieve the same result without pain. So like I said, I adapt it based off patient. So I'll usually get one or two light twitches, and then I'll actually put current through it and let it twitch and release the rest of the way, and then we're done.
That's great. Is there anything else education-wise that you feel separates you from anyone else that maybe post-grad you've done? Any classes you've really enjoyed that you would like to talk about?
Sure. So I always tease people that I'm a nerd for learning.
Yeah.
I have way too many books in my house. And through this whole coronavirus thing, I've localized more into one place. And my husband's like, good Lord, you have way too many books. But to me, knowledge is power. So if I'm not learning, I don't want to be doing what I'm doing anymore. So yeah, I worked with Ayurvedic specialist who's also an acupuncturist in California for a couple years after graduation. We would do weekly meetings over Skype. So she actually helped me learn. Michael Tierra is who got me into Ayurvedic herbs because he does Western herbs, Ayurveda, and Chinese medicine. So he has a herbal line called Planetary Herbals, which is pretty cool. So I did a short class from him, and that's what got me interested because I'd never heard of Ayurveda. So, and I didn't realize getting into it, it was actually a complete separate system of medicine, like Chinese medicine too. So they have their own pulse system, their own herb system, and all that. So what was cool is Nadine, my mentor in Ayurvedic stuff, she actually merged them together since she actually started with acupuncture because she was actually doing acupuncture school and Ayurvedic school at the same time. Wow. So she actually blended them together very well. So that's pretty cool that I have that knowledge. So I did that because of my Western background in ophthalmology. We did oculoplastics as well. So we did a lot of Botox, filler, and all that kind of stuff. So I'm all about natural anti-aging. So I had the benefit of training with Traval Kroom, who works on a lot of Victoria's Secret models. So I had done some previous training with some people on anti-aging acupuncture and I wasn't impressed with the results, if something doesn't work, I'm not going to do it. And if I don't see results on myself, I'm not going to sit there and offer it to patients and have them waste their money. So when I saw that Traval Krum was doing it, since his background was also in trigger point acupuncture, which is what I do and I love, I was like, oh, let me do this and see if it works. So I would say by far his system is more effective than any other system that I've taken. So you can actually go into the muscles on the face and you just put the needles and let them relax. And you can also combine it with microcurrent as well as LED to get the biggest bang for your buck. So it's primarily about education to patients, because you're not going to achieve the look of a facelift. What you are going to achieve is a younger, well-rested look. And it actually helps with the glow of the skin, where it looks like you just got back from a fabulous vacation in Hawaii. So he was one of my favorites. And then Rich Hazel is who actually got me started in orthopedic acupuncture. So I usually go do some seminars with him when I get a chance when he's teaching. Anthony Lombardi also does some stuff in Canada. So I'm trying to think who else. I love training. So usually I'm doing something every couple months to learn more. So yeah.
That's
I
great.
think those are the biggest ones that have the biggest impact on my career.
Okay. That's great.
Excuse me.
No, obviously you really love what you do, and it shows
Mhm.
your passion comes through for your patients and the patient experience. Do you have any specific groups of patients, age ranges? I know you touched on that you work with children as well.
Excuse me. So I used to treat more little kiddos, but I would say honestly the age range now for my preference, usually starting about 10, and my oldest patient right now is 99. So
Wow.
I actually love the age range difference because it keeps me on my toes. So for kiddos, I get to get on the floor, and work with them, meet them at their level, as well as for adults. I was always around, I don't want to say older people, but people in their 50s, 60s, 70s more when I was a kid. So that's kind of who I relate more to. So yeah, so I would say anybody that's in pain, as well as anybody that has systemic stuff, because I've gotten a lot more into functional medicine too, with Apex and Dan Kalish and all that kind of stuff. So I love being able to explain things to patients. So usually my own life and things my family has gone through has pushed me to learn more about things, because when they ask me questions about something, if I don't know the answer, I'm going to dig around and find it. So I like to be able to explain things to patients. So if somebody comes in with something and I don't know what it is, I have a pretty vast repertoire of knowledge in my brain where I can pull stuff out, or if not, I at least have the resources that I've trained with that I have the ability to go ask them. So it's pretty nice to be able to have somebody come in with something where they have no hope, and I can give them hope, and I can give them a better life. I can give them, the enjoyment of being able to play with their grandkids again, or being able to go work out, and things that we take for granted. But like I said, having been there and having had the pain, just getting out of bed, being able to sleep, being able to do basic things, it's so nice to be able to not do in pain. So yeah, so I like the whole age range.
No, that's fantastic. So one thing you touched on a little bit here that I don't think people generally really understand acupuncture. I think a lot of people just think, obviously from what you stated, and I know my experience with you, you're an expert on dealing with pain.
Mm-hmm.
But that is what acupuncture is known for. I know
Yeah,
you mentioned something about a lab called Apex.
sure.
What sort of things with this functional medicine would that entail that you would do for patients?
Sure. So functional medicine is basically like Chinese medicine. It's just a new name for it. So it's interesting to me how people come up with different names to kind of fit a new mold, or kind of what's coming out popular in the public eye. So functional medicine looks at the root, meaning where did the dysfunction start? So acid reflux or hip pain or anything like that. And they kind of start tracking back, okay, well, where did this start? What's not functioning properly? so that we can get it back to the optimal level of performance. So the way I look at it, Chinese medicine and functional medicine do the same thing, but like I said, they do it a little differently. So Western, same thing. It's Western and Eastern terminology. So you just have to learn how to interlink them. So for me, I like functional medicine because it looks at blood work differently. So most people don't realize, like if you go to Quest or LabCorp or somewhere like that, they have the normal ranges. Well, usually when patients are going to get blood work, guess what? They're not healthy. So they already have something that's not working. So those ranges are usually based off of unhealthy population. So you're actually having more of a dysfunction than you realize. So functional medicine actually looks at, okay, if I have elevated liver enzymes, what's my A1C doing? What's this doing? What's that doing? So it looks at the whole picture versus just, oh, look, your liver isn't working right. Okay, well, why isn't it working right? You know, what can I do to make it function better? Rather than just take, say, you know, a blood pressure pill or, you know, a diabetic medication. I want to know what I can do to change my lifestyle so that I'm not on a gazillion medications. And that's honestly part of what made me make the leap to Eastern medication, because in ophthalmology, patients would literally come in with 2 pages of medication. And I told my husband, I was like, oh my God, I don't want to be like this when I get old. I want to be healthy. However many years I'm blessed with on this earth, I want to be able to get around and function and have my mental capacities, you know? So it just really looks at the whole person, so you can actually find a dysfunction before it turns into a disease. So the other thing I'll touch on for a second too, because I haven't gotten it, thank God, recently, but when I first got into acupuncture, people would come in and say, oh, do you do that woo-woo stuff? And acupuncture is very scientific. Especially for me, I was raised Southern Baptist, so I get it. It's not witchcraft. It's nothing crazy. Some people, just like all primary care doctors, aren't created equal, and all physicians are not created equal. All acupuncturists, unfortunately, aren't created equally either. Not saying anything bad about anybody, because, you know, if it works for you, that's great. But for me, I explain things to you from a scientific perspective. And I'm working on muscles, ligaments, you know, blood, lymphatic system, that kind of stuff. So we work on things from a scientific perspective. I'm not doing witchcraft or hoodoo voodoo on you, I promise.
I know I've encountered this before. I'm just going to ask you the question. So
Sure.
acupuncture is not a specific religion or anything like that.
No, not at all.
Yeah.
So I have heard, and that's what I was honestly concerned about when I first got into acupuncture, as far as, oh, you have to be a Buddhist, because a lot of people that do acupuncture, well, they're Chinese, and that's what cracks me up. So my name's Julie Palmer. So patients sometimes will call, usually I get about once a year, twice a year. Is she Chinese? Oh, well, then she must not know how to do acupuncture. So unfortunately, just because someone's Chinese does not mean they know how to do acupuncture. So, and you don't have to be any particular religion. It's kind of like saying, if you go to your regular, you know, Western medicine doctor, do you ask them, what's your religion? I don't know about you, but I don't, you know, as long as they can get me better, I'm happy.
Yeah.
So yeah, so like I said, you know, I meet people where they are, but it's your belief system. I don't criticize you. Whatever my job as a physician is, do no harm. So my job is not to judge you for whatever your belief system is. That's fine. Same thing about politics. I don't get into politics with patients, because that doesn't affect how I treat you. You know, race, color, you know, whatever, wherever you are, it doesn't matter to me. I don't judge you. So yeah, not a bit. It doesn't enter into it. So it's whatever religion. It isn't associated with one.
No, that's great, because I think a lot of people, that's a common misnomer that people run into.
Yeah.
So what area is your office located in?
Sure. So I'm in Jacksonville, Florida. I'm actually in Mandarin, Florida. So the cool thing about Jacksonville, you can get pretty much anywhere in Jacksonville, Jax Beach, or anywhere around within 30 minutes. So I have some patients that come from Georgia, and it's about an hour for them, depending on which part of Georgia you're in. But I have people that come from the beaches, from Mandarin, from Arlington, from everywhere. So yeah, it's really cool. And then I actually have some patients, because of my history in ophthalmology. I do not specialize in ophthalmology, but I have a lot of acupuncturists in the area that know my background. So they refer patients to me, and I get patients from out of the country as well as from different states, for macular degeneration, for glaucoma, for all that kind of stuff. As well as then once I treat them, I can mail them herb supplements and all that kind of stuff. And then usually I'll check in with them and see them in person back once a year so that we can keep them going in between. But yeah, no, so I have people that come from all over, which is really cool. So I like to see people from different walks of life, different, generational attributes and all that kind of stuff. It keeps my work exciting. And anytime I get someone out of pain, I am so happy, because patients tell me all the time, oh my God, you must get so tired of hearing people say, oh, thank you for getting me out of pain. I'm like, oh my God, no, that's what makes me get up in the morning, because I understand. And it's so cool that I don't have to give you a medication to get you out of pain. I mean, and it's a permanent thing. It's not like, oh, I'm temporarily getting rid of your pain. If it's a degenerative process, then yeah, you have to come back and check in with me. And for most people, I tell people, acupuncture is like changing the oil in your car and putting gas in your car. If you don't put gas in your car, guess what? It's not going to work very well. And same thing, if you don't change your oil, yeah, your car will run for a while, but it doesn't run optimally. So doing acupuncture, for each patient, it's different. I have some people that come 3 or 4 times a year and we just do tune-ups, kind of quarterly tune-ups. For others, I have them come once a month. For others, I treat them every couple weeks for anxiety to keep everything managed. So my ultimate goal is to give you the tools and the tricks that you can do to manage things on your own at home. That's why I give you exercises. That's why we talk about meditation. That's why we talk about all kind of different things. My goal isn't to have you living in my office. There's no need. I'm not doing my job if I'm not getting it to where you can function outside of my office.
That's wonderful. Clearly you love what you do, and I think you've given some really good direction on what patients can expect, and some insight into things about acupuncture and what you treat. Is there anything else you feel like you'd like to add today that maybe we haven't hit on yet?
I would say the one thing I would say, I hear from patients all the time, well, I've had acupuncture before. It didn't work for me. So it's kind of like saying if you've been to one primary care doctor and it didn't work for you, meaning, you weren't happy with their bedside manner, how they talked to you, how they answered questions, stuff like that. I would encourage you, try someone else, come try me, or come try someone in your area. Because like I said, not all acupuncturists are created the same. Some have better bedside manner than others. Some are better explaining things than others. So acupuncture is really amazing in general. And even if you don't like needles, I mean, there are lots of other ways to get you out of pain and to help you than just needles. So acupuncture is not just needles. There are lots of ways to help you. So I would encourage you, try it, because you don't know if something's going to work if you don't try it. So, most people have to hear from someone else, hey, this person's really good, this worked for me. But like I said, I would encourage you, try acupuncture. It's an amazing thing. And who knows, you usually end up with someone for a reason. They may be to get you to someone else, or hopefully they're the one that will get you out of pain and change your life forever, and get you doing whatever it is that you want to do, because everyone has different goals in life. So yeah, so I would say that's probably it.
Oh, that's great. Thank you so much for taking the time out today and doing this.
Awesome. It was great to talk to you, and I hope to talk to you again soon, John.
Thank you. Definitely.